Most heart attacks do not begin suddenly. They occur silently years, sometimes decades before the first symptoms appear. By the time chest pain, breathlessness, or ECG changes show up, the disease process has already been active inside the arteries. But as we all know today, that heart disease is largely preventable. So, namaste, friends. I'm Dr. Bhasker Sharma, a pathologist and wellness coach. Today, I'm going to talk about daily habits, simple evidence based actions that protect your heart before disease ever starts. Not medicines, not emergency treatments, but daily choices that quietly keep your arteries young. This preventive way of thinking, focusing on risk before disease, is the same philosophy that guides modern preventive health screening platforms like Disha Health AI. Why prevention matters? Cardiovascular disease remains the number one cause of death worldwide. What's important to understand is this. Atherosclerosis begins as early as the teenage years. Plaque formation progresses silently. By middle age, many people already have subclinical heart disease. You don't suddenly get heart disease at 55. You accumulate it slowly through daily habits. That's why prevention today is no longer about reacting to reports, but about understanding long term risk patterns, how lifestyle, metabolism, sleep, and stress interact over time. This shift from isolated numbers to integrated risk is central to preventive frameworks like Disha Health AI. So, we talk about some habits. The first habit being move your body every single day. Physical activity is the most powerful non drug intervention for heart health. What science shows, this improves endothelial function. Endothelium is the inner lining of arteries. It reduces insulin resistance, lowers triglycerides, raises protective HDL, reduces blood pressure, improves heart rate variability. So, the key insight is that you do not need a gym. What works best? 30 to 45 minutes of brisk walking daily, or 7,000 to 10,000 steps per day, or 150 minutes of moderate exercise per week. Even 10 minutes walk after meals improves glucose and lipid metabolism. Consistency beats intensity. Your heart prefers daily movement, not a weekend punishment. The second habit we'll talk about is eating right. So, eat for the arteries, not just calories. Heart disease is not caused by fat alone. It's caused by inflammation, insulin resistance, and metabolic stress. Protective eating habits include more vegetables, especially leafy greens, adequate protein, nuts and seeds, fruits in moderation, whole grains instead of refined carbohydrates. What harms the arteries? So it is the excess sugar, refined carbohydrates, ultra processed foods, trans fats, frequent snacking without metabolic rest. So, one powerful habit could be stop eating 2 to 3 hours before sleep. This improves the insulin sensitivity, nighttime lipid metabolism, blood pressure patterns. Your heart has a circadian rhythm, and modern preventive models recognize that when you eat matters almost as much as what you eat. The third habit we'll talk about is sleep. So, sleep is a cardiovascular therapy. Sleep is not rest, sleep is repair. Chronic sleep deprivation raises cortisol, increases blood pressure, worsens the insulin resistance, promotes visceral fat. It also accelerates atherosclerosis. The science backed target is 7 to 8 hours of regular sleep. Even 1 week of poor sleep can raise blood pressure measurably. This is why sleep quality is now considered a core cardiovascular risk factor in preventive health approaches. The fourth habit, manage stress because the hormones matter. Stress is not just emotional, it is biochemical. Chronic stress may lead to elevated cortisol, sympathetic overdrive, endothelial dysfunction, and even higher clot risk. This explains why some people develop heart disease despite normal reports. Simple protective habits include 10 minutes of slow breathing daily, mindfulness or prayer, regular breaks during work, and limiting constant digital stimulation. Lower stress means better hormonal balance. The fifth habit, don't ignore your metabolic health. Many people with normal cholesterol still develop a heart disease. Why? Because metabolic markers matter. Early warning signs include abdominal obesity, elevated fasting insulin, rising triglycerides, fatty liver, borderline blood pressure. These changes precede heart attacks by years. A key protective habit is periodic preventive screening, even when you feel well and healthy. Early detection allows lifestyle correction, risk reversal, delaying or preventing disease entirely. This integrated risk first approach, rather than waiting for symptoms, is a core principle of our initiative Disha Health AI. Prevention is cheaper than treatment biologically as well as financially. The sixth habit, avoid tobacco and limit alcohol. No amount of smoking is safe for the heart. The smoking damages endothelium, it promotes clot formation, it accelerates plaque rupture, it also reduces oxygen delivery. Talking about alcohol, the alcohol in excess increases blood pressure, arrhythmias, and cardiomyopathies. The safest rule is no smoking and minimal or no alcohol. Your heart remembers every exposure. The most important truth, heart disease is not an event, it is a process, and processes can be modified. Small daily habits done consistently can delay disease by decades. It can prevent heart attacks and preserve quality of life. So, your heart works for you 24 hours a day. The least we can do is support it daily. Start small, be consistent, and remember, prevention always works better and best before disease begins. If you found this helpful, share it with someone you care about, because heart health is not just personal, it's collective. Thank you.